Hi, I'm Melissa, registered dental hygienist and Burst ambassador. This week's Burst TV will be doing a two-part segment. First week, we'll be discussing very common dental injuries in sports. And the next segment, I'll be discussing tips and tools to use to prevent your little one from having a dental injury. Sports-related injuries account for 40% of all dental injuries in the U.S. Nearly 80% of all dental injuries affect at least one of the front teeth, and they also occur more frequently in fast-paced and high-speed impacts. Now, I have a daughter who plays soccer and a son in karate who recently started sparring, and of course, I'm like any parent. The risk of injury is always on my mind, and dental injuries can be really scary. I'm here to discuss the common injuries and tips to help prevent them. Now, symptoms of dental injuries from sports can vary depending on the location of the injury. Damage to teeth can cause cosmetic and aesthetic problems, but athletes can also experience a lot of bleeding, swelling, bruising. Let's talk about the different parts of the teeth. The top part of the tooth is a crown. This is above the gum line, and then the whole lower half of the tooth is called the root, and that's located below the gum line. Now, the hard outer layer of the tooth crown is called enamel. Fun fact is the enamel is the hardest substance in our body, even harder than bone. Now, the layers below the enamel is called the dentin, followed by the soft tissue known as the pulp. This is the area where the tooth's nerves and blood vessels are located. Now, the soft covering of the root is called cementum. Now, sometimes an athlete can fall on the ground or get smacked or elbowed in the mouth or even get struck by a ball, puck, or bat. This can cause one or more of your teeth to get chipped. This is when some of the outer layer of your enamel breaks off and exposes the layers inside the tooth. Now, some symptoms you may notice is a feeling of jaggedness with your tongue, which can cause a little irritation on the tongue over time. Sometimes you can actually experience a little irritation around the gum tissue where the tooth is chipped. Pain from pressure on the tooth when biting is pretty common as well. Now, of course, a dentist will have to evaluate the tooth with the help of x-rays to determine the course of treatment if a chip happens. But a small chip may only require a dentist to smooth it evenly or even place a small filling. Now, if a larger chip occurs, it may require either a larger filling, an onlay, or even a full coverage crown. Now, sometimes the damage of the tooth is close to or exposes the nerve of the tooth. This may require root canal therapy, followed by crowning it. Now, sometimes an athlete can actually get hit in the face, and it could cause a crack or fractured tooth. Now, a tooth can have small cracks running across the surface. You may hear dental professionals call them crazed lines. These small cracks occur over time, yes, as we age, and typically only affect the outer layer of the tooth called the enamel. Now, crazed lines aren't usually a concern to our dental health and will cause no pain and are only really a cosmetic issue. But if a tooth cracks or splits from the top part of the tooth and runs downward, this is the true definition of a cracked tooth. Sometimes you'll notice sharp pain when biting, sensitivity when chewing food or drinking, hot and cold temperature sensitivity. Sometimes the pain comes and goes. Now, because a cracked tooth isn't always visible to the naked eye, it's pretty important to see a dentist quickly if an injury to the mouth or face does occur when playing sports. Now, unlike tooth decay, cracks are less likely to be diagnosed with x-rays. Now, a dentist can test the tooth and use magnifying lenses to help identify a crack. Sometimes a special dye or light is helped to help illuminate the crack, or just simply a dental explorer to help feel the surface of the tooth to help discover it. Now, the extent and location of the crack found by the dentist will help determine the prognosis of the tooth. And it's important to remember that the biggest risk with large tooth fractures and chips is damage to the nerve and blood supply, and of course, infection. Now, sports injuries like hockey are usually associated with teeth getting knocked out, but some injuries can actually cause the teeth to drive back into the jawbone. Now, this type of injury is called intrusion. This causes severe damage to all the little ligaments around the teeth, and it also disrupts the nerve and blood supply of the pulp. This can happen to athletes of all ages, and tooth trauma healing time can really keep them off the court and field for a long time. Now, just like a bodily bruise, Trauma or injury to the mouth can occur because you get hit or a blow to the mouth can cause a bruised tooth. Now, unlike a bruise on our skin, which can vary in different colors, a bruised tooth sticks to being pink or gray. So what does it mean when you have a pink or gray tooth? And what exactly causes this tooth to bruise? Well, the American Dental Association on its mouthhealthy.org site puts it simply that the pink means the tooth could be striving to survive, whereas the gray means your tooth probably didn't make it. Now, while waiting for your tooth to heal and for your dentist to determine the best treatment solution, make sure you take pain relievers. Inflammation from an oral injury can be very painful. So medications like ibuprofen or acetaminophen is really often enough to treat the swelling and aches. And of course, do be patient. Treatment for a bruised tooth might not happen immediately. Take time to heal and follow your dentist's instructions to prepare for the next treatment step. And be aware that the tooth trauma healing time can also vary. Probably one of the most traumatic injuries that can happen is when your teeth get knocked out. 5 million teeth are knocked out of their socket each year in sports activities and cost nearly $500 million to replace each year. But it's good to know if this happens, it doesn't necessarily mean it's lost for good. Proper emergency action can save the tooth so that it can be replanted successfully and last for years to come. Keep in mind, a knocked out tooth begins to die within 15 minutes. The first step is to carefully pick it up by the crown part of the tooth, never the root. If it's dirty, gently rinse with water. Do not use soap or chemicals, and do not scrub or dry the tooth. It's really important that you do keep the tooth moist. If you can, reposition the tooth in the socket immediately. What you're going to do is you'll gently push it in with your fingers by handling, again, always the top part of the tooth, which is the crown, and close your mouth slowly. Hold the tooth in place with your finger by gently biting down on it. But remember, always keep the tooth moist. You can either, if it doesn't go back in your socket, you can put it in the inside of your cheek or even underneath your tongue. Put it in milk. And of course, try to visit your dentist as soon as possible. If it's been more than 30 minutes, it is still possible to save a tooth. Once the tooth is placed back into the socket, a splint will be placed to help stabilize it for a course of the healing time. And keep in mind, healing time will vary. The root usually will reattach firmly to the bone in about 3 to 4 weeks. If the bone around the tooth is fractured, healing time can take up to 8 weeks. But your dentist will likely examine the tooth again after about 3 to 6 months. So how can I protect my teeth while playing sports? Well, keep in mind, an ounce or more of prevention is worth it when it involves your mouth. Well, I do hope you enjoyed this week's Burst TV segment. If you have any questions or concerns or comments, make sure you go ahead and comment below. Subscribe below if you haven't already, and hit the like button. Stay tuned for next week, where Chris Michelle will be discussing whether your baby is just teething or has an ear infection. And of course, as always, be safe. Take care.